Imagine lying awake night after night, your mind racing, your body restless, while the world around you sleeps peacefully. This is what millions with insomnia face: a sleep disorder that disrupts lives, affects health, and drains energy. But insomnia is treatable, and tonight can be the start of peaceful sleep again. In this video, learn insomnia's signs, causes, treatments, and how to reclaim your rest. What is insomnia? Insomnia is difficulty falling asleep, staying asleep, or waking up too early even when you have the chance to rest. It can be short-term, acute due to stress or environment, or chronic, lasting months or years, causing significant daytime problems like fatigue, mood changes, and impaired concentration. Symptoms and signs: trouble falling asleep or staying asleep, waking too early and unable to return to sleep, daytime tiredness, irritability, difficulty focusing, worrying about sleep, leading to a vicious cycle of anxiety. Physical symptoms like headaches or digestive issues. Insomnia often coexists with anxiety, depression, or other medical problems. Causes of insomnia: stress, anxiety, or depression, poor sleep habits, and irregular sleep schedule. Medical conditions such as chronic pain, asthma, or thyroid problems. Patients: caffeine, nicotine, and alcohol. Changes in environment or life circumstances like jet lag or shift work. Doctors diagnose based on sleep history, symptom duration, and impact on life. Sometimes specialized sleep studies help uncover underlying disorders. 1. Sleep hygiene and lifestyle changes. Regular sleep routine with consistent timing. Create a comfortable, quiet, and dark bedroom environment. Avoid screens and stimulating activities before bed. Limit caffeine, alcohol, and heavy meals near bedtime. 2. Cognitive behavioral therapy for insomnia. CBTI helps overcome negative thoughts and habits that disrupt sleep. Includes relaxation techniques, stimulus control, and sleep restriction. Considered first line and highly effective. 3. Medications used short-term, including prescription sleep aids, melatonin, or other agents, should be combined with behavioral therapy for lasting benefits. 4. Treat underlying conditions. Managing pain, mental health disorders, or breathing problems is essential for sleep recovery. Wind down with calming activities like reading or meditation. Avoid naps longer than 20 to 30 minutes. Get daylight exposure during the day to reset your biological clock. Exercise regularly, but not too close to bedtime. Keep a sleep journal to track patterns and progress. See a healthcare provider if insomnia persists beyond a month, significantly affects daily life, or if you experience depression or anxiety. Insomnia can be tough, but you're tougher. With the right care and habits, restful nights and energized days are possible. Peaceful sleep is a journey, not a destination. If this video brought you hope or insight, please like, share, and subscribe. Your support can help many reclaim their nights.